Health Secretary Steve Barclay plans to prevent patients who identify as transgender from using female and male-only hospital wards. In his announcement made to the Conservative Party conference yesterday, he also said a patient's request to have intimate care provided by someone of the same sex would be respected. His comments on gender ideology were backed by Home Secretary Suella Braverman. The Royal College of Nursing have suggested this proposal is playing politics while failing to tackle other issues. NTD's Jane Werrell earlier spoke to writer and researcher Belinda Brown for her reaction.
Hi, Belinda Brown, it's great to speak with you.
Thank you for inviting me.
Thank you. The Health Secretary says he plans to prevent men who identify as women from being treated in female-only hospital wards and vice versa. What's your reaction to that?
I think fantastic. I'm really glad to see common sense prevailing. I would expect it to prevail, and yeah, I think this is great. You know, women are not going to feel safe with men who identify as women on their wards, and men also will feel uncomfortable having women who identify as men on their wards. So. And I think it is actually particularly important because we're talking about the National Health Service. And if you talk about medicine, this is an area where actually sex differences are really important. If you want medicine to work well, you do need to acknowledge sex differences. It's a really key area. I'm really pleased to hear about this, you know, to hear about the Conservative Party actually behaving as conservatives and sort of holding on to what the truth is, kind of thing. Yeah.
Tell me about some of the concerns, particularly around having men who identify as women in women-only spaces.
Well, there have actually been, there has been a huge number. I was checking the statistic. There has actually been a huge number of sexual abuse within hospitals. I think there's been criminologist Joe Phoenix found that there had been more than 6,500 rapes and sexual assaults recorded in hospitals in England and Wales, which includes rapes of several children under the age of 13. And some of these, quite a high proportion, I think, I can't remember the statistic, 1 in 7 or something like that, has happened on wards. So this is a really serious issue, but I don't think it should take the risk of rape and sexual assault to stop this. I mean, I think men also will rightly feel uncomfortable with having trans men on their wards. I think we need to acknowledge sex differences when we're formulating policies. It doesn't mean that people aren't free to identify as they want to identify. You know, they are absolutely free to do so. But there are certain areas where we do need to respect that sex is important, and you know that women's safety is one of these areas, and health is one of these areas.
Well, Belinda Brown, thank you so much for coming on.
Okay. Thank you. Thanks, Jane.